There's a lot of different sort of things that you can do. So for women, you can do massage of the area. You can use vaginal dilators to help relax the muscles. You can take suppositories that have medications like Valium or Baclofen, which are muscle relaxants, and that can help as well. Although they're not treatments, they're more of a Band-Aid, but they can help with the symptoms that you're having. And then you can also, I think the best thing is to work with the physical therapist, because they can teach you certain exercises that will help down train the pelvic floor. For example, one of the ones I tell my patients is like happy baby pose. It actually, stretches and elongates the pelvic floor muscles.
One thing that I've experienced extreme pain from, and that stopping was one of the best things that ever happened for my pelvic floor, was to not do any kind of crunching movement with my legs crossed. I would go to these yoga classes at one point in my life, and they'd have everybody do these crunches. And I've always done some abdominal work here and there during the week if I'm being diligent. But they would have us cross our feet. And that seemed to lead to some pelvic floor discomfort that was similar to what I had experienced when I did the Kegels. But is there anything about the anatomy of the neuromuscular connections or vasculature of the pelvic floor that would provide support for my experience there? Doing crunches with legs crossed is essentially, is it possible that it's creating asymmetries in the pelvic floor?
Whatever intra-abdominal pressure you're causing to increase from the exercise, whether it's a squat or a crunch or whatever, you're increasing your abdominal pressure, your pelvic floor is then contracting to help stabilize that. So that can be part of it. And you can get nerve inflammation as well that can also cause pain. And so this is kind of how it all comes together.
I'm so glad that you mentioned blood flow. I think our entire discussion today should be framed up, at least in the back of our minds and the minds of our listeners and viewers, as involving at least three things. Anytime we're talking about erectile function or dysfunction, or pelvic floor function or dysfunction, or vaginal lubrication or lack thereof, we need to think about the hormonal influences, the blood flow related influences, and the neural influences, including the neural influences that come from the brain, the signals of arousal, for instance, or lack of arousal, and so on. So we won't be overly systematic in our parsing of all this, but